that would be hard on the students. Number one, they're just learning how to manage their own health care and how to manage what they should and shouldn't be doing when it comes to being sick.
I heard that it's not super helpful, so I was kind of nervous to go at first.
Sending an 18-year-old to an emergency room by themselves for the first time is kind of ill-advised.
I did this all by myself and have no idea what I was doing, and it was just kind of overwhelming, the paperwork process, and then I'm sick on top of it.
I think the health center environment is the place where they can start to learn how to take care of their own health care needs.
American University may be home to one of the most progressive and most vocally involved campuses of students when it comes to discussing issues we feel are important and should be addressed. However, the active conversations on the topic of our Student Health Center become more of a conversation of mutual discomfort or a complaint session. Our claims are brushed off, our concerns are degraded by members of the administration and by support and medical staff here on campus. There is more that can and should be done to resolve this problem. As the conversation of perfecting an accessible and universal healthcare system in this country continues, there is a similar and salient strife between students and university administrators contending the availability of medical care on campus. As students grow to understand their needs as productive members of society, it is important for them to understand the emphasis of maintaining and monitoring their health when appropriate. Therefore, the Student Health Center on this campus must rise to meet these needs by creating a more accessible environment for them. This means not having a wait time of 45 minutes to an hour. This means not embarrassing or ridiculing people when they feel there is something wrong. This means providing appropriate diagnoses when all students visit the center for help. To begin the conversation, I'd like to first introduce Ruby, a freshman here at AU, to tell us about her personal experiences visiting the center.
So the first time I went to the Student Health Center, my ear felt like it was clogged, and I didn't know if I had an ear infection or some other big problem. So I made an appointment and I went, I checked in. I had to wait for 45 minutes to an hour. And then I saw the doctor and I told him my problem, and he didn't believe me. And he was like, "There's nothing I can do for you." And he made me pay the $20 copay. I feel like I'm getting gypped in this scenario, you know?
The second experience Ruby had at the health center was even worse than the first.
A couple days pass and I wake up at 6 a.m. and there's something wet coming out of my ear, and I can hear clearer now compared to being clogged from the couple days before, and it's blood. And I know blood should not be coming out of your ears, so I go to the Student Health Center right as it opens at 8. I walk in and I'm blood is coming out of my ear and I'm freaking out. And the ladies are the doctors are having their weekly meeting right now, and the earliest appointment available is at 10:45, so you have to wait until then. And I'm blood is coming out of my ear.
After trials 1 and 2 of using the health center on American University's campus, Ruby was forced to go off campus to the Minute Clinic, which is an unfamiliar place for a new college freshman to go on their own.
Yeah, I was a little nervous because up to that point I've only gone to the pediatrician, and I've gone with my mom, and she's filled out all the forms for me, and I do this all by myself, and I have no idea what I was doing, and it was just kind of overwhelming, the paperwork process, and then I'm sick on top of it.
Especially with the blood coming out of your ear.
Yeah, the blood coming out of my ear was a little distracting.
Do you have any advice to students who are nervous going off campus as you were and feeling like the health center is inaccessible?
Yeah, going off campus, it's good if you have a certain type of insurance. I know my roommate has this one type of insurance that's based in Virginia, and they didn't take it. And so you have to do your research on that, or you'll have to pay hundreds of dollars just for medicine.
is also a freshman here at American University and has faced issues similar to Ruby's when she became sick in her first semester as well. What were your expectations of the center before using it for the first time?
Just that it's not super helpful, so I was kind of nervous to go at first.
Did you make an appointment or use the walk-in hours available to students?
I made an appointment.
Was it easy for you to find a time that fit in your student schedule with classes during the week?
Yeah, they were pretty good about that because I told them it was kind of urgent, even when it probably wasn't as urgent, but it's fine. But they were good with it.
How did your expectations compare to the experience you had?
I felt like I needed to go back home to my other doctor because they told me I had allergies when I had bronchitis.
So you were skeptical of their diagnosis?
I was very skeptical of their diagnosis. They told me just to rest, so I kind of did that for a couple days and I wasn't getting better. So I just went home to like my own doctor because I thought it would be better to have.
Right. And your own doctor told you you had bronchitis?
Yes.
Wow. Do you think you will be going back to the student health center anytime soon?
I hope not. I'd rather just go home than pay the money to go to the student health center if they're not going to help me.
What would you say if someone asked you how would you solve the problems that you saw at the health center?
They do a good job of trying to make sure you're taken care of, but I feel like they need to do more thorough checks instead of just assuming it's one thing right away. I feel like they need to go through multiple assumptions.
Well, thank you very much for your time. Of course. I hope that you don't have to go to the health center anytime soon.
Thank you.
Next, we will hear from an AU freshman's mother discussing the realization that the health center is not exactly as advertised.
Well, I think that most parents expect the health center to act like the student's primary care away from home.
So as of right now, the hours of the school's health center do not include the days on the weekends. What is your response to this fact?
Well, I think that our experience at home has always been that there's like doctor's office hours during the week, but the office was open on the weekend for like urgent care type thing. And so you didn't have to go to the emergency room.
As of right now, if a student does face an emergency on the weekends, they must call either 911 or go to a clinic or go to a hospital, which all are off campus and unfamiliar to students. So,
yeah, I would think that would be hard on the students. Number one, they're just learning how to manage their own health care and how to manage what they should and shouldn't be doing when it comes to being sick. So I think that one of the things that has evolved in healthcare is that doctors' offices are open on the weekend to solve the problem of people using emergency care when they shouldn't be using emergency care.
What was the process of going about either deciding to get the school's health insurance or not deciding to get it? What was the process in that?
For most families, if you're paying for health care through your employer or through something else, you're not going to also pay for the health care that the university offers, because then you're paying for it twice. There's really no reason to do that. But the challenge for people who are far away is that you could be in an HMO where you need to authorize care through a doctor. So the healthcare system is also making it hard. We chose to keep Sarah covered under our health insurance, which means that she needs to use health services at school, because otherwise we're in a managed care program where she would need to contact her doctor at home and get approval to go to any emergency room in DC, and that could be problematic. That could be construed as a healthcare problem. It could be construed as a health services problem, but I think the school should manage its health services within the environment that healthcare is in. A college and a university is meant to transition a student. Sending an 18-year-old to an emergency room by themselves for the first time is kind of ill-advised. They're not going to know what they should be doing. And I think the health center environment is the place where they can start to learn how to take care of their own healthcare needs. I would not feel very comfortable with my student being alone in a city 11 hours away by car trying to manage an emergency room. I would want the health services office at the college to be helping her learn how to manage her own health care.
Can you think of any possible solutions to the kind of discomfort and the unapproachable environment of the health center as of right now, it seems?
Well, I think from what I've heard in the few times that it's been needed over the first semester, I think that the hours and the appointments seem to be challenging. The size of the health center compared to the number of students that might need it seems to be disproportionate. I think that they either need to have more appointments available to students or perhaps open for limited hours on the weekend for more of an urgent care, need to see somebody, but not quite rising to the level of an emergency room visit. There's definitely going to be emergency room visits, and I think that that's unavoidable, but the students shouldn't have to manage their health care so that they don't get sick between 8 o'clock on Friday night and 8 a.m. on Monday morning.
So, what now? What do we do about this? The active conversation I talked about earlier must now transform into a public one, not just from peer to peer, but from peer to staff, from peer to advisor. The last time a complaint was reported about the health center in our campus newspaper, it was responded to within a month with a change in appointment booking and weekday hours. The conversation of mutual discomfort, our beloved complaint sessions, are now meant to be heard by those with the power to fix it.